I think I get asked every single day, what do I do with all this medication that I've been prescribed by all of these doctors, potentially for years? And I have a whole drawer full of medication, and I don't know if it's a benefit. I don't know if I need it. I don't know if I'll need it in the future. It's hard to throw away things that still have good value. Medications taken by people they're not prescribed for can be very dangerous, if not deadly. Our pain patches, they carry much more medication than a person would normally think of. Our oral medications can have very untoward effects for people that don't have that disease process, or say they're young children, pediatric patients. They can be very harmful. And another issue that I get asked about a lot is, but what if I need it, or what if one of my family members need it? I'm going to ask you and say this very firmly. Don't share your medication. You never know what the side effects are going to be. You don't know how that person's going to react. It may have worked really well for you. It could be toxic for someone else. You don't want to be that person that caused harm or an issue or even addiction in a family member or friend. Let their physicians handle that. I recommend strongly that medications that are no longer used get disposed of appropriately. I'd like to recommend to you, from a pharmacist standpoint and a physician, I recommend that people dispose of their medications. The recommendation for disposing of medications is to not flush them down the toilet. The sewage treatment plants can't clear these medications out of our water. They get put into the streams and our lakes, and fish and plants don't need opioids and nausea medications or birth control pills. They don't need medications like that in the waterways. It's much better to dispose of it in one of three other ways. If there's a disposal facility at your pharmacy, at the local police station, someplace that's official that will dispose of medications, that's a great place to take it. If not, you need to take it into your own hands. And I recommend that you get some clumping kitty litter, put it in a Ziploc bag, mix the medications in there with some water. It turns into concrete, put it in your trash can. The other one is mix it with wet food material, put it in the trash can and just throw it away. Make sure that people don't have access to it, that they can't take it from your trash can and use it potentially. You just never know who could have a problem with abuse or dependency, addiction with medications. You don't want to be an access point for them to get medication. If there are any questions at all, you know that I brought this up to you before, but let's do a brown bag special visit, which means you shove all your medications in a brown bag or a laundry basket and come in and let's go over them one by one. And I can explain to you which ones might be worth keeping, which ones should be disposed of.